Thanks to those of you who are joining us both on Zoom and on Facebook Live. We're really excited to get started. My name is Julie Babbage, and I'm the Executive Director of the Diabetes Patient Advocacy Coalition. Welcome to the Washington Diabetes Advocacy Forum. We're excited to be with you today virtually and to discuss the top issues in diabetes advocacy and how you can grow as a diabetes advocate through Deepak. So you'll see on the agenda for today, once we can pop it up, there we go, that we'll start with a quick overview of Deepak and have a discussion after that with today's special guests. We have speaker Lori Jenkins and floor leader Jacqueline Maycomber. That's really exciting because 3 out of every 4 registrants today indicated that you have not yet gotten the chance to meet with a legislator. And so after today, you can say that you have. So thanks to those 2 for joining us. After that, we'll take a look at some policies, which takes us to the issues themselves. And we'll give an overview of our top priorities as an organization, which really center on affordability and access for people with diabetes. A couple of housekeeping items. If you have questions for the panelists at any time or for us, please submit them to us and we'll either answer them in writing or we will ask them aloud as we have time. Today's meeting, just a quick note, is being recorded here and on Facebook Live, and we'll be sure to send that link out after, especially as some of you may have to leave early or join late, just so that everybody can see the full program. So to begin on Deepak, I mentioned that we are working on behalf of all people with diabetes. Our mission is solely advocacy, and that includes state work, like in Washington, but it also includes federal work and anything that makes meaningful changes in law and regulations so that people with diabetes can live long, healthy, and productive lives. And Deepak formed because it started to become abundantly clear that lawmakers were not getting to hear from the patient community when they were making decisions that impact patients. And it can be tough to keep up with the issues that go on. And so Deepak is focused on making it easy to advocate for yourself and your family as legislative issues arise. We have events like today. We have resources and other options on our website to really help to educate and empower our entire diabetes community, who we know is really passionate and wants to be involved. And we're so grateful for that. We are affiliated with the Diabetes Leadership Council, which is the policy side to our organization that really centers on advocacy. So DLC works on things like drafting legislation. They help to educate lawmakers and staff on action to take, while Deepak brings together the patient community to speak up and speak out on the issues themselves. And both of us partner with organizations across the diabetes community to build consensus on the action that needs to be taken for people with diabetes. And as we head into our session today with Speaker Jenkins, leader Maycomber, just a quick look on where Washington stands in terms of the legislation that it has passed. So you see here a checklist of the issues. These are not all of the issues by any means, but these are a lot of the ones that we see filed across state legislatures and the ones that we're tracking that we know are good for people with diabetes. So you see a couple check marks. You see one for the Diabetes Action Plan, an insulin copay cap, adult Medicaid coverage for CGM, as well as child Medicaid coverage for continuous glucose monitors. That's a great start. And we know also that there is a lot of opportunity as well in Washington to check some more boxes. So that's something that we're going to be talking about today. And we'll go ahead and transition into our panel. I'm first going to introduce our panelists, our panel moderator, who is Ed Hawthorne, the vice chair of Deepak's affiliate organization, the Diabetes Leadership Council. He is a former chair of the board for the American Diabetes Association, and he's served on several other boards, including the Red Cross and the March of Dimes. He is currently the chief operating officer and managing director of CE3 Solutions. Ed has been really active in diabetes advocacy over the decades and very generously volunteers his time for our cause and events like today. So Ed, thank you so much for joining us, and I will turn it over to you.
All right, well, thanks, Julie. And for today's panel, we are so grateful to have with us 2 legislators and champions for people with diabetes. And so without further ado, I'd like to get the introductions done. So first we have House Speaker Lori Jenkins, first elected to the State House in 2010. Speaker Jenkins represents the 27th House District in Tacoma. During her time as a member of the House, Jenkins has served as chair and vice chair for the Judiciary and Healthcare and Wellness Committees, and last year became the first ever female and first ever LGBTQ Speaker of the House in Washington State. A veteran of Washington State Public Health, Jenkins earned her bachelor's and master's degrees from the University of Wisconsin-Madison and a Juris Doctor from Seattle University School of Law. And next we have Representative Jacqueline Maycomber, who was appointed to her 7th district seat in 2017, representing 5 counties in Northeast Washington. She serves as floor chair for her caucus and is a member of both the Healthcare and Wellness Committee and Capital Budget Committee. During her time in Olympia, she has sponsored legislation to help reduce the cost of insulin and better address the needs of the diabetes community. A former biomedical research scientist and law enforcement officer, Representative Maycomber earned her bachelor's degree in biochemistry from Colorado College. So let's get started. And the question that I have for everyone is, everyone has a connection to diabetes in one way or another. So can you tell us yours and why you work on this issue? And we'll start with Speaker Jenkins.
Thanks, Ed. Sorry, I was too distracted with trying to get my video on, so I missed your question.
Okay. Well, we'd like for you to share with us what your connection with diabetes is,
Sure.
Why you work on this issue.
Yeah, well, it's really great to be here with you all, and it's great to see Representative Maycomber. We've worked together a lot on these issues. For me, it's quite personal. I'll be going soon on 50 years as a juvenile diabetic. Got it when I was a kid, and my father is a diabetic. It runs quite a clear line through my dad's side of the family. In fact, I have four great uncles who died before insulin was discovered as a treatment for diabetes. All died of diabetes. So the strong link for my family, and then my healthcare background, working in public health and in the healthcare setting, those things combined, and probably working in the healthcare area I was very motivated to do that because of being a diabetic. So very personal reasons for my involvement.
Oh, thank you for sharing that. And Representative Maycomber, how about you?
I actually just came into this world. We're almost into 3 years. I was at session, and I knew something was just a little bit off about my son. I had taken him to actually the ER a couple times during session on the weekends, and they just kept telling me everything was fine. And one day I was on the floor, and as Speaker Jenkins knows, I got the call that my son was type 1 diabetic. He was just turned 8 years old, and he wasn't doing very well. So it was a difficult time getting home to Spokane, and it was eye-opening, and thank God for people around me to help and really support the new group I was now a part of that I didn't know existed. And Speaker Jenkins was one of those people, and still is when I have questions, because sometimes it's a learning curve all the time. And I think that we work together to try to figure out, how to get through the process and teach my young son how to thrive in this world. And it was eye-opening when I went to get my son out of the hospital. I went down to the hospital pharmacy, and they, had that pile they give you to leave, and you're thinking, even with a biochemistry degree, how am I going to do this? But it was over $1,000, well over $1,000, and it wasn't, we'll bill you later. It was now. And I had no idea. And I was blessed enough to be able to pay for that, but I was thinking who would be able to pay for this new diagnosis, new world that we are in? And it was shocking. It was traumatic in that situation.
Well, thank you for sharing that. And both of you, have experienced firsthand the challenges of living with diabetes. And so we really appreciate you sharing that with us. Representative Maycomber, you sponsored House Bill 2662 during the 2020 session, which caps insulin costs at $100 per month. And you were just talking about the cost there. So could you share more about the bill and what other measures it includes and how it might impact people with diabetes in the state?
And Speaker Jenkins has equal investment into this policy and actually helped write it. What it does is it caps insulin costs to $100, which I greatly just, experienced. I was excited the bill's working because we just experienced that. It really has that opportunity to kind of bring down those life-saving costs. But additional, which I'm really excited about, I've been working with the governor's office. It has a prescription drug task force. And it really looks at those life-saving medications, including EpiPens, and why those costs have increased, some words upward of 500 to 800% in the last decade. What are those reasons for those costs? Where are we losing it from manufacturing to the patient, and what's occurring? And so it brings a large group together, including patients and providers, and says what's happening to these costs, and where can we look at where we're getting these high astronomical responses in the market. So I'm really excited about the task force. It hasn't started yet. COVID's pretty slowed it down, but we're starting to get people onto the task force, and the governor is getting people appointed. And I really look forward to seeing what occurs, because that's the conversation we need to have for anyone that has a difficulty getting their life-saving medications.
Absolutely. And I hope that task force includes the PBMs as well.
Oh, yes.
Integral in the cost of that. Thank you so much for that. And Speaker Jenkins, you sponsored legislation addressing patient access issues like step therapy and non-medical switching. And could you share more about those efforts and how it helps people with chronic conditions?
Yeah, well, I mean, those of us who have long-term chronic illnesses, and my healthcare provider tells me this all the time now, you know more about this disease than I do, Lori, right? And so part of that legislation was really about recognizing patients with long-term chronic illnesses who have already gone through a number of different medications, and they know and understand what is best for them and what's best for their body. Also working with their healthcare provider to decide that, and they shouldn't have to continue with the insurance industry having to fail through a number of treatments to get to what they already knew worked. So that was kind of the philosophy behind those bills, but when it comes to diabetes care, like the work that we do on everything from food safety and access to healthy foods to access to insurance. I mean, one of the most significant things that I think about a lot personally, and I think maybe a lot of diabetics do, especially if you get this as a child, it really does govern like jobs that you might think. When I was a young person, I went into government service in large part because I was uninsurable personally. And so I needed to go somewhere that had group insurance so that I could feel like I could really care for myself. And so it has impacts, far beyond what people might think. It has impacts in kind of what jobs you choose, where you choose to work. I know, in my other job, I work for the local health department here in Tacoma, and we've been working a lot on behavioral health issues and trying to operate more in the shallow end of the pool, and recognizing, for example, that diabetics are twice as likely to have depression as non-diabetics are. So because many diabetics do have primary healthcare providers, what can we do to work with primary healthcare providers to make sure that they're doing screens for depression and getting people into the treatment they need before someone gets in a worse situation and ends up in the deep end of the pool, either with their diabetes care or with their behavioral health issues. So anyway, that was way far beyond, Ed, what you asked me about, but I'm really excited about how things touch each other, and we have to work in many areas to try and help people with long-term chronic illnesses, and especially diabetes.
Well, thank you for sharing that, because those connections are really important for us all to learn and understand. And the more that we all make those connections, then the better that we can all support each other. So thank you. So it's also been well reported that COVID, as well as diabetes, has had a disproportionate impact on certain segments of the population, generally referred to as health inequity. So my question is, how are the leaders in Washington working to address this for communities of color? And Representative Maycomber, I'll start with you.
Well, I know that we did have some policies last year that really looked at that with the health districts, and Speaker Jenkins is involved in that more. Um, on, and I can't speak for individuals of color, but in on the tribal side, we are working really closely and have funded. I live outside a tribal community, and that's where a lot of our health districts are have funded a lot of having the healthcare access, making sure that we have providers in the area. And that's one of the biggest things, especially if you suffer from one of these, life-threatening disorders, is making sure that you're not going long distances for a provider and that you have a provider close at hand if something occurs, and making sure you have that access. I know COVID greatly impacted our families' availability to access certain things, including infusion sets and pump availability, because a lot of people weren't answering the phones. They were working from home. You got 5-hour waits, which I find shocking, sometimes 3 to 4 days before returning a call. So making sure that everyone has that ability, that they have access to those PBMs and those providers, that you make sure you get your supplies delivered. There was some very scary times in the last year for at least our family, and we lost some services and some supplies, and it was difficult.
And Speaker Jenkins?
Yeah, Ed, this is a great question. One of the things that the House Democratic Caucus did last year is we tried to apply an equity lens to all of our policy work and our budget work. And a big part of that equity lens, it was really bringing people with lived experiences to the table to engage in policy making and in budget decision making. So we know that Black African Americans have a very high rate of type 2 diabetes, and that is rising also in our Latino communities. So finding out what we tried to do with our interventions is to make sure that we brought folks from those communities and other communities to the table to talk about what kinds of roadblocks were being faced. In particular, for the long history in the Black and African American community, the long history of mistrust, for good reason, of the healthcare system really prevents a lot of people from getting the treatment they need. And while Jacqueline and I really work a lot in the type 1 diabetes area, because that's what I have and that's what her son has, there's a lot more people who have type 2 diabetes. And so then we really start to look at the social determinants of health. And Jacqueline mentioned this, people having access to, walkability in their neighborhoods and safety to get to their doctor's appointments, having health homes. We've done a lot of work here in Washington State on getting people into health homes because the outcomes are much, much better for folks. But we're also doing things like we passed a piece of legislation last year that required our medical schools and our continuing medical education for our physicians to for them to have some education on diversity and equity issues, both in their primary education and in their continuing education. So these were all things that we tried to do, and there were a lot of others to try and bring lived experience to the table and to advise. I mean, I'll just say, I was shocked. This was probably 5 or 6 years ago when I was in a healthcare hearing, and I found out how many diabetics are non-compliant with taking insulin. And it was just because it was it was something that I would never have considered in my entire life from childhood on. I consider insulin to be the thing that saves my life every single day. And so really digging into what those issues are about and why. Is it cost? Bringing down cost, will that help? But are there other things that are impediments to people really living a healthy, full life? So anyway, tons more work to be done here, but I think we're moving in the right direction.
Yeah, and I think it's really interesting because, as I've read that, the type 1 diabetes, the prevalence is decreasing for non-Hispanic whites, but growing in people of color and Hispanics over the next 20 years. And now you're seeing children developing type 2 diabetes. So now, is that children with diabetes? What is that? And then everyone is facing the same issues of availability, access, and affordability. Those 3 words just keep repeating themselves across all chronic condition types.
Yeah, absolutely. And I think one of the other big questions and I'm definitely not most up to date on the research, but generally diabetes is considered an autoimmune disease that is not that much related to inheritance and maybe more related to environment, right? So when you start to think about the explosive growth of type 2 diabetes in particular, and the shifts in type 1, right? So how much is diabetes related to our environment? It's just, I guess all I'm doing is continuing to ask a series of questions, right, that we always have. But there are so many questions to be answered to figure out how we can engage in the best way to help people.
Yeah. And I mean, that leads me to my sort of next question, which is at Deepak, we believe that diabetes is a nonpartisan issue. And Speaker Jenkins, in your role, you work with colleagues from different parties and different areas of the state. And how do you work to find common ground on issues of diabetes with your other colleagues?
It's not very hard. Honestly, I mean, obviously the challenges that Jacqueline discovered with her son, are just incredibly scary. And I did not have her experience. I was the kid that my parents worried about, right? So I was, but that, that fear for your child and wanting to help them grow strong and healthy is incredibly motivational I know for Jacqueline, but for all members. And we have a number of members, both in my caucus and in the House Republican caucus, who are diabetics. So honestly, the ubiquitousness of the disease kind of helps make it nonpartisan, because people see that everybody can get it. Well, I think one of the struggles I've had is I've really wanted to do a diabetes caucus, but I have been unsuccessful at finding the right people in the Senate. It's probably because I'm not as connected to senators. So, right, we have a lot of people in the House that would do it, but I'd like it to be four corners. And I just haven't yet successfully identified folks who really in the Senate, not that they're unwilling to engage, but I think that people who are diabetics probably have exercising that leadership might be good. So I'm still hoping we'll be able to do a diabetes caucus too. But this is a place where philosophy tends to break down, and it's really about people and helping people. And we get to see that everyone's affected by it. And so that helps it become nonpartisan.
Well, it's interesting because, Deepak has an army of advocates. And so if ever we could be of help, you just have to call on us and we'll be there helping and calling on senators as well. So just know that we're here for you as well, as you have been for us. And Representative Maycomber, what about you?
Oh, I think she's absolutely right. I was going to hold back and give a Senate joke, but she's been very professional. The speaker has. I thought she was going straight in for a Senate joke, but yeah, I mean, the thing about healthcare is it's all of us, right? I mean, we all are affected by healthcare. We all are affected. The year before, I helped write and co-sponsored the bone marrow bill. And, that's something that unless you've been touched by it, which, I haven't, that you don't know that it's so struggling to find somebody with a match. And so, and this is the same thing. You don't know it until you're in it, how hard it is. Hey, for the 2 a.m. wake up parents, that wake up and check their kids' blood sugar at 2 a.m. You don't realize that's, going to be for a while, that's this new world. And so, when you're a part of that, it's important to share it. It's important to share those struggles of life because somebody else is gonna have to experience that and be strong. And I told my son he's had some bad days after that basketball game, and he was tired and not feeling good. And he said, "Well, why do I have this? Why was I punished?" And I said, "Oh, you are gonna be somebody's hero, but you don't know it." And so you don't realize those, 11 p.m. low moments in life that those are the ones that are going to pick up another kid. And that's true with being a legislator. We can't always empathize, but it is our job to sympathize and protect and listen and take care of people. I just so happen to be in this position, but on many other positions where people are really doing the best they can in life. And so anything I can do and anything Speaker Jenkins to do, no matter what party you're in, that's our only job.
Thank you. But we have a question from one of our champions who asked about lowering the copay limit cap.
Yeah, I don't know, Jacqueline, if you're working on that, and I don't know if anyone is working on that this session, right? The challenge with the copay caps almost always is, first for legislators, we look at our Medicaid rates and what that what the funding would be in order to do that. And I think one of the things that the Affordable Care Act then requires is that for private insurance companies, we also find a way that we cover that. So I think one of the ways that we would probably look at that is we look at the raw budget dollars, but for advocates, I think that looking also at the increase in compliance for treatment and how that drives down long-term costs for complications of diabetes would be a really worthwhile thing to do. Because that's my expectation and my belief is that costs hugely drive diabetics in terms of what treatments they use and they don't use. And so if you can lower costs, again, my theory is you increase compliance and you decrease long-term negative consequences and complications due to diabetes. So that's how I would, if I were crafting the bill, which now as speaker, I don't sponsor bills anymore, which somebody should have told me that before I became speaker. But anyway, but that's how I would look at it if I were a member. And Jacqueline, you may know more about whether or not people are working on this right now.
Well, it's a 2-year, the bill that you and I worked on, it was a 2-year bill. And so what the task force is, I'm hoping that will do is that you won't just have this thrown out number, right? Like all of a sudden now, the pharmaceutical, or the insurers throw out a number that will have to be covered, right? That difference. What we'll do is in the task force is really review, well, why have our costs gone up 800% on these insulins? And so when we look at that and really get that snapshot, I'm hoping that progression of understanding of cost won't just be a burden onto the budget or insurers, which, would be, passed out. But we can look at how to limit those costs before we get to that step, right? Before we get to the step of making sure that that's covered. So why have those costs increase? And, there's many, many different reasons, including lowering the cost of some other places. Maybe we can get them from other areas and we can do, co-sponsoring with other states and seeing what happens. But having that task force is really going to help as we project towards those long-term costs. So I think hopefully we can get that done and really review that. And there's been a lot of things occurring. And I know it was impactful, and this is really important for Deepak to really look at. But in our healthcare hearing, when we were in person in 2020, a woman was testifying, a young lady, and she was talking about, and I believe it was my insulin bill. I don't recall which exact bill it was, but she showed her CGM, and then she showed her infusion set. And what I heard for days from other legislators are, well, I have never seen it. I didn't know you needed all that. I didn't know that's how insulin was delivered. And that was so impactful. I mean, it was something I never thought was going to happen. I didn't even know her, but she lifted that shirt and said, I need this every 72 hours, to deliver the insulin. And I need this, and I need this, and that was very impactful. That was emotional. And you saw what's carried on the body. Sometimes a screen, or sometimes you get, the pamphlets, it doesn't show up, but seeing her, that very young lady, just really emotionally describing what was keeping her going, impacted the healthcare panel and impacted the legislators. And I know Senator Frocht had some policies regarding durable medical equipment and moving it into the pharmaceutical prescription area, which I also would love to go to Walgreens and buy it. My insurance company didn't do that. I'd have to order it, and it's always difficult. And so I have been working on making sure that if you need those durable medical equipment, you could go to any pharmacy and get it. And so there are some positive things occurring.
Well, thank you so much, because I think, your task force sounds really exciting, because not only does it look at the continuum of the costs, but it looks at all of the players involved in there, where you can actually get everyone talking about those components of cost that will be so huge for people with diabetes. Now, I know I have one last question before Julie gives me the hook. And the last question that we're asking is, what's the best way for smart advocates to help you work with you and engage their representatives? And often we hear that just a couple of folks writing in can get a lawmaker's attention.
Should I start off, Jacqueline? Yeah. Yeah, I think that is really helpful to write in. But so one of my pieces of advice is, waiting for legislative session is perhaps the worst time to meet with your lawmaker. They're meeting with a myriad of people over issues that are as widely diverse as you can imagine. And it's just, they're so busy that it's hard for things to sink in. So really work on meeting with your legislator in the interim. It's very helpful if you are a constituent to reach out to the legislator from your district, to talk to them specifically. But here's the thing, like, people get really nervous that they want to know all of the science and all of everything there is to know about a bill or a topic area. I can just tell you right now that any of you advocates out there already know more than almost every legislator. I mean, you might happen upon a Jacqueline Maycomber or a Lori Jenkins who knows a lot about diabetes, but generally no. And so don't feel like you have to have all this kind of book knowledge about things. Telling your story and the experiences that you've had and what you're trying to achieve. If your experiences are that costs are making it hard for you to manage your diabetes, then you should give the personal examples of what's happening to you and why. There will be bills out there and you might know the bill number and you should reference the bill number. But I think that's the most important thing to do, is to get in early, tell your story and tell the legislator why that's a problem and how that's hurting you long term. And that is kind of one of the best ways to motivate legislators to work on these issues, I think.
And Representative Maycomber?
Absolutely. I would say tell your story, because we legislate with logic and budgets and RCWs and WACs, and we're word and very cerebral and we keep it legal. But the truth of the matter is we're here for each other. And when you hear stories, and even if they're personal and sometimes difficult, people move mountains to help others. And that's the point, right? And so sometimes when you have that conversation and constituents, don't be afraid to tell your story, no matter how hard it is. And by telling that story, sometimes, different minds get together, and that's how we do, collective thought and come up with these great solutions that we didn't have before. And so, but they have to know. They have to know if they're voting and they're creating laws. We have to know the stories, and we have to know how they impact us.
Well, thank you both so much for joining us today. I really, really appreciated the conversation, and thank you for being champions for people with diabetes. And now I'll turn it back over to Julie.
Yeah, I was just also going to add a thank you first for your insight, which is a great view inside the work that you're doing. It helps everyone on today really understand what's going on. I learned a lot. We'll definitely work on making sure that legislators understand what diabetes looks like, the work that goes into staying alive and then thriving, managing a disease 24/7, 365. And we've had several folks write in just to say thank you for your time. It means a lot. And more even than the insight was sharing your personal stories is a great example for us and for our advocacy community, that it's a critical time to share our connection, to explain the human side of this disease. I love the reference from you, Representative Maycomber, on the hero in your son, which is so sweet and so powerful, and just gave me chills. And Speaker Jenkins, that you could speak to the challenges and triumphs of having diabetes for decades and your own struggles to be insured, because that's certainly something that we're talking about and working on today. And just one last thought is that it's so nice to see your genuine friendship and working relationship as you tackle an issue that's personal to both of you. And this is an era where we see a lot of disparaging comments across the aisle. So it's refreshing for all of us to see a productive, human, compassionate conversation with hearts and minds really in the right places, to not just talk, but to take action. And that makes such a difference for us. So thank you very much.
Thank you, and good luck, everyone.
Thank you. Thank you. And feel free, you can turn off your cameras and stay on, or jump if you've got more things to do in your day. But again, really means a lot to have you on and to hear from you personally. And the overview that you just heard really sets us up so well for the next part of today's conversation. We're going to pull back up these slides and give an overview of the state of Washington politics, from the congressional delegation to the state process itself. And we will start with Congress. So like every state, Washington has 2 senators that are elected every 6 years. And this, in this photo specifically, you can see Senators Murray and Cantwell, both Democrats. And then in the House, you have 10 members, 7 Democrats, and 3 Republicans. One group in Congress, oh, and by the way, at the bottom of the screen right there, you can find out who your representative is if you're not sure. But on the next slide, one group in Congress that's really important for our patient community is the Congressional Diabetes Caucus. A caucus is a group of lawmakers where they come together on any subject over shared concerns or shared interests in an informal way to specifically work on that issue. A caucus is often very bipartisan. And that's a good indication, like our panel was, that diabetes should not be Democrat or Republican issue. And these also exist at the state level. You heard our panel mention that as well, and that there's an opportunity on that scorecard to check the box for a diabetes caucus to give it special attention at the state level as well. And notably, the caucus in Congress is the largest health caucus that they have. So that's really exciting that there are actually more members who are not in the caucus for diabetes than there are who are not in the caucus. So one of the asks that you can make on our website at any time is to make sure that folks like Representative Strickland on here, who are newly elected in November of 2020, join the Diabetes Caucus, so that freshman members are part of this group. So this action is open for you if you are a member of Representative Strickland's district, and we encourage you to send a letter. We've got it typed up, but you can of course add your own personal ask and story. Being in the Diabetes Caucus doesn't necessarily mean that a member will take certain action, but it is a sign that they're committed to understanding and working on diabetes. And the ask itself means a lot more when it comes from a constituent. And so that's why we have these actions available on our website. Next, let's move into a state overview, which is really what today is about. Washington is one of 38 states where there is a trifecta. So that means that the House, the Senate, and the governor's office are all held by members of the same party. In this case, the Democratic majority is in the state House has been the case for the past few years. So it's helpful to understand these dynamics, because it means for a bill to pass in the legislature, it needs to have a majority of legislators support it, right? And so if the majority is Democrat, that means there need to be some Democrats who are supporting the bill. It also means that bills with no Republican support can pass the legislature. But specifically in Washington, it's worth noting that Governor Inslee, if he were to veto anything, Democrats cannot achieve the 2/3 majority override with just their own party. And so they don't have what's called a supermajority. And that fosters more of a working relationship a lot of times. Legislative cycle is 2 years long in Washington, and odd numbered years when the state budget is debated, the legislature meets for 105 days. And then in even numbered years, like 2022, the session will meet for 60 days. Currently, Washington is out of session, and they will not adjourn until 2022. But that means that there's a lot of good opportunity, like you heard again in the panel. This is a time when a lot of conversations are happening, when a lot of work is going on. And so we'll have some of those conversations behind the scenes, and then we'll ramp up our advocacy efforts as bills are filed and as we know more about what this session holds. And we do that by reaching out, by making connections, by raising our voices. Legislators are coming to state capitals with all kinds of issues in mind, many of which are specific to their own areas and regions. And that's why it's important to let them know as constituents, the folks who are electing them, that diabetes really matters to you. And it motivates them to pass legislation to help. And speaking of which, on this slide, we have just a little graphic here about how a bill becomes a law, including Bill from Schoolhouse Rock, who tells you himself in his song that it is not easy for a bill to actually pass. Hundreds of bills in the State House and in Congress are filed every year, and they die, meaning that they don't have a vote in committee. They're not even discussed. But there is a step in each part of the process for advocates to be involved to make sure that a bill really can make it through all of these parts, starting from when a sponsor files a bill, which you see in that far left purple box, and then heard in committee based on the subject matter, whether it's health, or it could be education. Maybe it's asking for funding for diabetes, and so it goes to a budget committee. And if a majority of that committee votes yes, a subset of the legislature, then it moves to the floor, where a majority of the House or Senate, whichever chamber it started in, can then vote yes. And then if it passes the floor, it moves into the other chamber, so the House or the Senate, whichever it has not been to, and begins the process again. So this just means that there are a lot of points where hearing from you makes a major impact, and Deepak is going to work with you to help find ways for you to use your voice when it matters most. Next slide is just a chance for us to talk about actually becoming a diabetes advocate. For those of you who are a little bit new to this, Deepak has an advocacy community of what we call champions or advocates. We have thousands of subscribers, but a champion is someone who, beyond a subscriber, is taking action and getting involved in a more substantial way. So just by joining us today for this forum, you're joining a network of champions, and we rely on these individuals to be involved and to help their families and their communities also be involved and sign up to advocate. So our ask for champions is to recruit 5 or 10 people who also care deeply about diabetes or who care deeply about you to sign up as well, because the stronger our numbers, the more that we can accomplish. As you heard from the panel, it doesn't always take, hundreds and hundreds of people weighing in. A lot of times, a really personal note from a few folks can make a difference. Just a quick note, recap on becoming a Deepak champion is to take action, and sometimes that doesn't happen as quickly as we want it to, but we stay motivated, and we eventually get a lot of things done. So we're excited to have you as part of our Champions Network, and join us for other events. We had a virtual Hill Day where we had 25 states and District of Columbia represented over the course of a week, with meetings where participants got to meet with their senators as well as their own representative. And it was really successful. We just had that a couple weeks back. And we will have more events like it where you have a chance to meet with Congress, as well as events like this where we're coming to your state and we're asking you to get involved specifically with state legislation. Next slide, please. So this is just one more point to make, that our stories do have an impact. We've said it multiple times today that your story matters. And this is what it would look like if you were to click on our Click Advocacy portal on our website and send a letter. That you'll be able to add a personal message, which you can kind of see there at the bottom of the dialog box. But if you were to write your senators, this is exactly what it would look like, where the form preloads, and you can quickly send an email on things that matter and are making a difference for people with diabetes. Next, just wanted to say thank you so much for attending. Again, sorry we're 5 minutes over, but hopefully you got a lot out of today. We will be sending a recap where you can tune in and watch today's conversation again if there's anything you missed. And don't forget to sign up to be a Deepak advocate, to follow us on social media, to share this with friends and family, and also to make sure to tell your story and be part of this amazing group of people who, as you can see from all of the panels today, are really passionate and really dedicated to making a difference. So thank you so much, and we hope to see you back again soon.